So today we'll be discussing about blood chemistry. Blood chemistry is essentially a diagnostic test. Okay, you have already discussed about. I'm sure you must have studied about this in the previous year in either biochemistry or in some other subject. These are basically different enzymes and different biomarkers through which you can assess diseases. In the sense that if there is any of these, which I'm going to discuss, if there is an abnormality in the level of any of the following characteristics or parameters, you can uh, diagnose or you can surmise that there is some problem in the patient's body. And what do you call, it might be indicative of a disease or it might be indicative of a condition which is hiding. All right. So first of all, we'll come to, there are around 12 blood chemical parameters. We'll discuss one after the other. First of all, aminotransferases. So aminotransferases में आते हैं आपके AST and ALT, aspartate transaminase and alanine transaminase, AST and ALT, or you can also call that SGOT or SGPT. Okay. AST is also called SGOT, ALT is also called SGPT. Serum glutamate oxaloacetate transaminase, serum glutamate pyruvate transaminase. Okay. कभी कभी transferase भी use करते हैं. Now, in any case, normally these are इसके normal values जो रहते हैं. So for AST, the normal value is close to around 40 international units. Okay. Then for ALT, it is around 35. Okay. Varies a little bit, but that is the upper limit. In any case, now whenever you see that liver is the richest source of ALT, okay, and several tissues are rich in AST, specifically heart, muscle. उन लोग में AST ज़्यादा रहता, ALT will be higher in liver. As such, levels of AST will significantly increase, or there will be a problem in AST levels when you see necrosis of or inflammation of heart, या फिर myocardial infarction हुआ. One of the ways to diagnose myocardial infarction after it has occurred, so let's suppose there are a few patients जिनके अंदर myocardial infarction is not apparent. Okay, they will not be able to understand that they had myocardial infarction. It might just be a discomfort, and after that they might have some other problem, or they might be in coma, or there might be some problem or the other where they are not detecting it. After maybe a couple of hours or maybe couple of 1 day or 2 days, you will see a spike in AST level. Okay, because AST is particularly rich in heart and particularly rich in the muscle. Whenever there is necrosis or inflammation of heart, you can guess that there might be a problem in muscle tissue or there might be a cardiac problem due to elevated levels of AST. One way of determining that someone had myocardial infarction is generally what happens around 3 to 8 hours after onset of attack, it will start spiking up. Okay, slowly it will keep spiking up and it will come back down to normal at around 3 to 6 days. So this starts to spike up after MI. Okay, around 3 to 8 hours after MI, it comes back to normal around 3 to 6 days later. So you have a around 3 days window wherein you can detect that the patient had myocardial infarction based on AST, and there are other cardiogenic markers as well. You will have LDH, you will have AST, थोड़े और रहते, troponin, tropomyosin levels. वो पूरे देख के you can summarize that okay, this patient might have had a myocardial infarction. We might need to treat them, or they might be permanent cardiac damage, things like that. Now, ALT is specifically high in case where there is liver disease. Okay, different kinds of liver disease may. Now sometimes you will see both ALT and AST spiking. Sometimes you will see more of ALT spiking rather than AST spiking. Now specifically, let's suppose common liver diseases है, उसमें ALT ज़्यादा होता compared to AST. Okay, because this is specifically related to liver or very rich in liver. Generally, whenever a patient has liver disease, their ALT levels will significantly spike. There might be a spike in AST levels as well, but not as much as ALT. One thing. देन अगर अर्ली स्टेजेस ऑफ जॉन्डिस है, ठीक है, वो टाइम पे दोनों की एक्टिविटी हाई रहती, दोनों बहुत एक्सट्रीम लेवल्स में सेक्रेट होने लगते. ऑल्सो इन हेपाटिक इस्कीमिया, okay, condition where your hepatocytes are not getting enough amount of oxygen and blood, okay, as a cause of, because of parenchymal damage, ALT and AST levels will increase. जो cell के अंदर enzymes है, that's if the cell gets degenerated, if it gets destroyed, the enzymes that are present inside will start pulling out. ठीक है, that is why you will see increase in AST and ALT levels. In cirrhosis, the elevation is less, but you will see very high in hepatic ischemia. Now, अगर hepatic tumor हो रहा, primary हो या secondary हो, hepatic tumors, in both of in primary and hepatic tumors, you will see spike in both AST and ALT. If there is skeletal muscle dystrophy, or if there is polymyositis, polymyositis is a condition in which several muscles are undergoing inflammation, okay, because of some condition, underlying systemic disorder or some condition. In such a case, what happens is there is an increase in AST activity, whereas ALT might be normal. So this is specifically skeletal muscle. If the patient is having muscular dystrophy, or let's suppose they are having muscular necrosis, yeah, there is a proper problem in the skeletal muscle tissue of the patient, वो condition में AST will be particularly high, whereas ALT might be slightly elevated or normal in some cases. Okay, so that is about aminotransferases. That is the first parameter. And the second parameter will be bilirubin, serum bilirubin. Now bilirubin जो है, it is made from hemoglobin. Specifically, whenever you have senescent RBCs, meaning old RBCs, वो जब मरते, the dead old RBCs, they will release a lot of hemoglobin, which is converted into biliverdin, ultimately converting into bilirubin. That bilirubin is sent to your liver, all right, so that it can be processed and it can be thrown out. Now, this process of conversion specifically occurs in reticular endothelial system, meaning spleen, bone marrow, Kupffer cells of your liver. All of these are responsible for conversion of hemoglobin into bilirubin. Now, as such, normal bilirubin levels can be divided into three main categories. You can have total bilirubin, direct bilirubin, and indirect bilirubin. Okay, direct bilirubin and indirect bilirubin together will form total bilirubin. So we have total bilirubin, you can remember it this way, is equal to direct bill plus indirect bill. Okay, उसके नीचे levels लिख देता मैं. So normal levels of total bilirubin is close to 0.2 to around 1.2 mg per dl. Okay, mg per 100 ml, deciliter is basically 1/10 of a liter. So then direct bilirubin जो है, it will be around 0.1 to 0.4 mg per dl. Please be careful of the units when you use it. Okay, even if you are studying it or you're using it in an exam, if you convert it into mmol, it will change. All right, be careful of that. Indirect is around 0.2 to 0.7 g per dl. All right, now a condition called hyperbilirubinemia, meaning increased amount of bilirubin in blood, is which is the cause of clinical jaundice, occurs when total bilirubin increases more than 3. Okay? If this value becomes more than 3 mg per dl, that is when you will see clinical jaundice. Okay, you will start seeing a few clinical symptoms. Hyperbilirubinemia occurs. अगर latent jaundice है बोले तो 2.5 to 5 mg per dl होता. Apparent jaundice, when you have visible symptoms, severe symptoms of jaundice, that will occur at more than 5 mg per dl. Okay, at 3 mg per dl you will start seeing a few signs. At 5 mg per dl you might see all the signs of jaundice, or you might see significant hepatic injury as well. Now that is variable depending on what is the cause of jaundice, where it is happening. Pre-hepatic है, hepatic है या post-hepatic है, jaundice का cause. Depending on that, you will see particular damage. But as such, there will be liver damage to to a certain degree. All right, right. In jaundice, generally what happens is total bilirubin is increased and conjugated bilirubin might be increased. All right. Now what happens is bilirubin को बाहर फेंकने के लिए your body, so uh, now hemoglobin है, hemoglobin is being converted into bilirubin. ठीक है. This particular bilirubin is called unconjugated bilirubin. ठीक है. ये unconjugated इसलिए है because there is one particular enzyme called glucuronil transferase. Okay, that glucuronil transferase, what it does is it will bind to bilirubin, it will conjugate with bilirubin and it will form conjugated bilirubin. ठीक है. Just writing Cbil. What is the difference between these two? This is water insoluble. Okay, this is water insoluble, this is water soluble. Why do you want to convert it into water soluble form? Water soluble form agar raha, so it will be able to, your body will be able to excrete it out of urine and feces. If it is water insoluble, it will not be able to get excreted properly, and it will not be able to transport properly. That is why unconjugated bilirubin is converted into conjugated bilirubin. Generally what happens is in case of jaundice, especially depending on the type of jaundice, either unconjugated or conjugated or both of them will increase depending on which type of jaundice is occurring. ठीक है, ऑब्स्ट्रक्शन से हो रहा या एक्सटेंसिव हेमोलाइसिस से हो रहा या लिवर प्रॉब्लम से हो रहा, डिपेंडिंग ऑन दैट. Then we have the next parameter, serum calcium. Now the normal levels of serum calcium is around 8.5 to 10.3 mg per dl. Now these values will slightly vary. Now if you just in some other textbook, this is in your textbook. If you check it in some other textbook, you might find 8.6 to 10.3. थोड़ा vary रहता, plus or minus 0.2. Okay. जरा इधर उधर vary करता, but generally it will be around 10 to 8 to 11 range, not more, not lesser than that. In case of newborn children, थोड़ा बढ़ के रहता value. Okay, the upper limit will be slightly higher and the lower limit will be slightly lower. In newborns, it is around 7.4 to 13 mg per dl. All right, now you might have hypocalcemia and hypercalcemia where the serum calcium levels is decreasing more than normal or it is increasing more than normal. Now it can happen because of a variety of reasons. Let's suppose we talk about hypocalcemia. Okay. Now, calcium is very important for not just your bone health because almost 98% of all the calcium is present in your bones and teeth. Okay, they act as a reservoir for calcium in your body. If there is hypocalcemia, the body's bones and teeth generally become weaker. Okay, you will also find a little bit of calcium present in plasma, extracellular fluid, very little amount in RBC and intracellular fluids as well. But most of it will be present in bones and teeth. Now, as such, if there is a significant reduction in serum calcium, it can cause tetany. Tetany is not tetanus. Okay, tetany is a different condition wherein because of hypocalcemia, the patient will have muscle ache, they will not be able to move properly, all of that will occur. In any case, uh, there are a few conditions that are causing hypocalcemia either directly or indirectly. Now, some of these conditions will include hypoparathyroidism. Okay, PTH क्या करता? PTH is responsible for whenever let's suppose serum calcium levels बहुत कम हो गया, parathyroid hormone will remove a little bit of, it'll cause bone resorption. It will go into long bones, it will remove a little bit of calcium and throw it into your blood, so that serum calcium levels are stabilized. Later on, calcitonin will come into picture, wherein if what do you call, if the serum calcium levels are very high, it will take whatever excess calcium is present and it will throw back into the bones, so that bone health is maintained. They work in a cycle. Now, if there is hypoparathyroidism in a patient, it can generally lead to hypocalcemia. और if there is nephrotic syndrome, nephrotic syndrome में basically calcium का reabsorption बराबर नहीं हो रहा, या फिर the patient has ARF, advanced renal failure rather than acute, advanced renal failure. Okay, the patient might have attacks of acute pancreatitis. Okay. Another reason is if you are transfusing a lot of blood, especially citrated blood into the patient, या फिर the patient has very high serum magnesium levels, ठीक है, very high plasma magnesium levels, ठीक है, especially after you have intravenously infused magnesium into the patient's blood, magnesium salts into the patient's blood, that is when hypocalcemia can occur. Or it might be malabsorption from GIT. So the patient might have steatorrhea, or they might have sprue disease, or they might have celiac disease, wherein absorption of calcium is not occurring properly through your gut, through the intestines. Okay, that is when serum calcium levels are also low. Okay, uh, malabsorption through GIT. Okay, so these are some of the causes that can cause hypocalcemia. Then we have on the flip side hypercalcemia, where there is specifically increased amount of calcium in blood. Hypercalcemia. So one obvious reason वहां पर hypoparathyroidism हो रहा होता है, यहाँ पर hyperparathyroidism होता. Okay, because of hyperparathyroidism, hypercalcemia can occur. If there is more amount of PTH, more amount of parathyroid hormone will remove a lot of calcium from your bones, calcium phosphate and all of that, and it will put it into your blood. Or if there is cancer, malignancy, yeah, fair, if there is Paget's disease, if a patient is on excessive vitamin D therapy, some patients will self-diagnose themselves as what do you call, that they have very low amount of vitamin D. As such, normal individuals do have, even what you call healthy young people do have little bit lesser amount of vitamin D, which needs supplementation, because humans are not just outside as they used to be. If you see, as for evolution as well, our ancestors used to stay in the sun for a much longer time compared to us, right? So they did not have a problem where they had lack of vitamin D. Most of the humans nowadays stay indoors. Okay, especially in such conditions they will stay indoors. Even if they do go out, it will not be in an excessive time of duration where you are in the sun or you are outside properly. You might, even if you go to an office, let's suppose you're moving out of your house and you're entering another building and you're staying in indoors. Okay, so you're not exactly exposed to light as much. That is why vitamin D deficiency generally occurs. But on the flip side, what happens is sometimes people will overdose themselves with vitamin D. Okay, way too much amount of vitamin D unregulated can cause hypercalcemia. Or if the patient has sarcoidosis, okay, some cases of sarcoidosis have presented as are presented with hypercalcemia. If the patient is on thiazide diuretics, on diuretics, it will decrease excretion of calcium. Thiazide diuretics, okay, hydrochlorothiazide and chlorothiazide, both of them. If the patient has milk alkali syndrome, where let's suppose absorption of calcium is increased from your gut, that is also when hypercalcemia occurs. So these are the conditions in which the patient will have hypocalcemia or hypercalcemia, some of the conditions. Alright, now coming to the next one. serum chloride levels. Now, sodium potassium chloride, generally they go hand in hand, okay, along with some other inorganic salts like magnesium, bicarbonate, phosphate. All of these are very important, okay, especially important constituents of your body fluids, which are important for maintaining electrolyte balance in your body. Without proper electrolyte balance, you can either undergo dehydration or you can have edemas being formed. Right, either of them can occur. Now, as such, to maintain your plasma volume, whether it is in the blood or intracellular volume, these electrolytes are very important because they will make up osmotic gradient, a very important part of osmotic gradient. Agar there is improper distribution of these ions, electrolytes, there might be electrolyte balance which can lead to a host of problems. Now, as such, serum chloride levels you have on an average diet, there is around 10 to 15 grams of chloride present in the body, in the whole body, okay, as NaCl. Okay. Now, as such, इसका rotation होता रहता, so around 10 to 15 grams of NaCl is excreted out of your body, and if you are having a normal diet, in that case the same amount will be reabsorbed back or you will consume it back as well. Okay, so that cycle continues. Now, as such, अगर serum level particularly mg per dl के base पे देखें तो it is around 98 to 105 mg per dl. Okay. Now, low chloride excretion in urine is generally seen when your body is retaining chloride. Okay, retaining chloride in body fluids. So, low chloride excretion occurs when chloride is being retained inside the body. Now, this retention can be because of several reasons. It can be chronic nephritis, it can be inflammatory conditions, yeah, edema, heart disease, या फिर malnutrition. The patient is simply not eating enough amount of chlorine. Okay, some people will restrict their sodium chloride or salt consumption so much that they will go into low chloride levels. Okay, see, both high amount of NaCl and low amount of NaCl is bad. You need to maintain a moderate amount inside your body. Generally, people what they do is, in order to avoid hypertension or any other problems associated with the increased consumption of salt, they will decrease salt consumption to such an extent that it will start creating problems. Now, as such, this will be more apparent in areas where it is very hot or during summers, because you will sweat more, and sweat generally contains a lot of salt in it. Okay, especially as such normal conditions में उतना problem नहीं है, but if you profusely sweat for the whole day or for a significant part of the day, that is when chloride and sodium chloride excretion will be excessively high, and if you're not consuming enough amount of it through food, it will be a problem. It will create a significant problem. All right. Any other condition where water is lost, let's suppose the patient is having vomiting or diarrhea, उसमें भी chlorine levels बहुत कम हो जाते हैं. Or फिर Cushing syndrome. Okay, if the patient has Cushing syndrome, a problem in cortisol levels, that can also cause particular low serum chloride levels. All right, so these are all conditions where chloride levels can get affected. Now, coming to serum creatinine. Now, creatinine as such is a waste product. Okay, once there is creatinine metabolism in your muscle movement के time पे creatine metabolism होता. Creatine is something that you get from your food. Okay, as you consume different types of food, you will get one particular protein called creatine, and that creatine, or one chemical called creatine, that creatine, when it undergoes metabolism, the end product is creatinine. All right. Now, this creatinine, the normal levels of creatinine is around, again, it depends from age. Okay. Normal serum creatinine levels If it is a child less than 12-year-old, this level will be around 0.25 to 0.85%. Okay. Agar, let's suppose it is an adult male, it's around 0.7 to 1.5%. Then if it is an adult female, it's around 0.4 to 1.2. Okay, mg percent. So all of these are mg percent. Now, it is generally higher in males because of increased body size and increased amount of muscle mass. Alright. Now, increased serum creatinine levels can be because of several reasons. Generally, if a patient has high creatinine levels, it is indicative of impaired GFR. Okay, GFR and creatinine will go hand in hand. Glomerular filtration rate अगर बराबर नहीं है तो generally what happens is serum creatinine levels will increase because your body or specifically your kidney will not be able to filter that creatinine out of your body, because of which it will get retained inside your body, hence serum creatinine levels will rise. Now if there is renal failure या फिर डायबिटिक कीटोएसिडोसिस या फिर द पेशेंट इज इन स्टारवेशन या फिर उन लोगों को फीवर हुआ, ठीक है, और इफ दे हैव एनी मसल वेस्टिंग डिजीज, डायबिटीज, डायबिटीज mellitus specifically, या फिर hyperthyroidism, in all of these conditions you will see a spike in the levels of serum creatinine. Okay, sometimes even in pregnancy. So as such, it is no, normal or most common condition is a impairment in renal function. Okay, whenever serum creatinine levels is high, there are a few drugs also that can cause serum creatinine increase, but they will generally do so because of impairment of kidney. There will be nephrotoxic drugs that are decreasing GFR, because GFR is decreasing, serum creatinine will increase. Okay, अगर filtration बराबर नहीं हो रहा तो serum creatinine will not get excreted out properly, because of which its serum level will increase. All right. Very rarely do you see decrease in serum creatinine levels. More often than not, there will be increase in serum creatinine levels because of whatever disease or drug that the patient is being subjected to. All right. So we'll continue with blood glucose levels and thyroid function test tomorrow. We have a few more blood parameters.